So my name is Matthew Wellington. To introduce myself, I'm the campaign organizer with Maryland PIRG's End the Misuse of Antibiotics campaign. We're here with local doctors and health professionals, Dr. Leah Brown, Dr. Tyler Simmons, Dr. Robin Gilden, Louise Mitchell, and Dr. Jeffrey Kaplan to release a new poll that shows the overwhelming concern of doctors with the use of antibiotics on animals that aren't sick. According to the new poll and analysis Prescription for Change, 93% of doctors polled expressed concern with the use of antibiotics for growth promotion and disease prevention on animals that are not sick. Doctors need antibiotics to keep working, and they want farms to stop giving these medicines to healthy animals. Nearly every major public health group has come out against this practice, saying that reforms are needed if antibiotics are to continue working. Yet the meat industry acts as if this is too bitter a pill to swallow. According to the poll, a further 97% of doctors expressed concern about the growing problem of drug-resistant infections. Nearly a third of those doctors polled had a patient that had either died or suffered serious implications and consequences from a drug-resistant infection in the past 12 months. That number jumps even higher for doctors that work in both outpatient and hospital settings. Other important findings of the Consumer Reports poll include that 85% of doctors report having had a patient or more than one patient with either presumed or confirmed case of a multi-drug resistant infection in the last 12 months. Of those doctors that treated a multi-drug resistant infection that was either presumed or confirmed, nearly 35% of those doctors had had the patient either die or suffer serious consequences from the illness. Also, 80% of doctors agree that their practice, hospital, or group that they work for is actively working to stop or minimize the inappropriate prescribing of antibiotics. So, antibiotics are a pillar of modern medicine. These miracle drugs are losing their effectiveness due to growing emergence of superbugs, which are bacteria that are resistant to one or more form of the drugs. The phenomenon is fueled by widespread and untargeted use, and the over-administration of antibiotics on factory farms is a large contributor to the problem. Over 70% of our antibiotics used in human medicine and 80% of antibiotics in general are sold for use in food animals each year. This is typically done to speed the rate at which these animals gain weight and to prevent disease caused by unsanitary and unhealthy conditions. This past fall, last month, President Obama issued an executive order to tackle the problem of antibiotic resistance. The report did not require a halt to the overuse of antibiotics in animal farms. The administration did announce at that time, however, that a national action plan will be unveiled in February 2015, which gives them a fresh opportunity to stop all inappropriate uses of antibiotics in food animals. A growing body of experts in the United States and across the globe is calling for stronger action on this. The U.S. Center for Disease Control recently estimated that over 2 million Americans each year get sick from drug-resistant bacterial infections, and 23,000 die each year. Furthermore, a World Health Organization report recently on this issue estimates that resistant infections result in an additional 8 million hospital days, which cost between $21 and $34 billion every year in the United States alone. We are joined here today by local doctors and health professionals who are on the front lines of this important public health problem. They are going to speak about their experience and why it's so important to solve this public health crisis. 9 out of 10 doctors say that antibiotics should not be misused on animals that aren't sick, and the Obama administration needs to hear their voice and stop this practice cold.